Since its nascent detection in the early 80s in Asia, HIV and AIDS has become a global pandemic, with virtually every government in the world having a special program for it. In Africa, it has become a leading cause of death, robbing nations of young and energetic populace, critical for economic growth, and at the same time compounding the already existing difficult social conditions by leaving an ever-enlarging trail of orphans to be cared for by the geriatric population. The pandemic is being attacked from all imaginable angles, ranging from science, politics, and entertainment. Not to be left behind is this frenetic frenzy in religion. According to UNAIDS, the United Nations Programme on HIV, the total number of people living with HIV and AIDS in the world in the year 2008 was 33.4 million. Of these, 15.6 million were men, 15.7 women, and 2.1 million were children. The Ecumenical HIV and AIDS Initiative in Africa, Ehaia, was launched in 2002 by the World Council of Churches, popularly known by its acronym WCC. WCC is a global fellowship of churches with a membership of 349 churches, out of which 96 are in Africa, and together they have developed a model for a theological response to the HIV pandemic in Africa. The East African Regional Office is headed by Reverend Pauline Wanjiru Njiru. She runs the secretariat of the organization.
For a long time in the early 80s and 90s, when HIV first came, churches stigmatized people living with HIV a lot because of the belief that they had got the disease through sin. But by working with church leaders, we are able to unravel the realities so that we see that HIV modes of transmission are many and they are not necessarily sinful. And even if they were sinful, even if people got HIV through sexual sin, we try to help the church leaders to understand and to embrace and exhibit the love of God.
Under the aegis of WCC, a higher partnership includes churches, ecumenical and theological institutions in Africa, ecumenical agencies in the global north, WCC, and most critically, people living with HIV.
Now that I know I am positive, how do I live my life as a person and a leader of faith, of conviction, and of hope in transformation?
Driven by the vision of a transformed and life-giving church, embodying and thus proclaiming the abundant life to which we are called, and capable of meeting the many challenges presented by the pandemic, Ehaia is tasked with the role of coordinating and facilitating capacity building workshops, seminars, and consultations.
As we venture forward, we can find ways and means of collaborating and enriching this program together.
With a nerve center at WCC headquarters in Geneva, Switzerland, and operational offices in 5 regions, and 2 theology consultants based in Angola, Zimbabwe, Kenya, Democratic Republic of Congo, and Togo. The team operates in English, French, and Portuguese. Reverend Pauline is assisted by Mr. Peter Ngige, who handles the finance and administrative aspects of the organization.
This regional office is run by 2 people. The main person being the coordinator, the regional coordinator, and then myself. Then what we do, because being 2 of us, it's humanly impossible to manage everything. So what we do, we normally involve facilitators who help us to do the things that we are not able to do immediately.
Ehaia has partnered with many organizations in executing its mandate. St. Paul's University is one of the key partners of Ehaia. Professor Esther Mombo Deputy Vice Chancellor in charge of academic affairs, explains how the institution has established an infrastructure of dealing with HIV and AIDS.
In 2000, therefore, St. Paul's chose to take the lead of training its clergy on what was known then and is known as a Christian response to HIV and AIDS. Most institutions were not able to start dealing with issues of HIV/AIDS because they always argued, where are the resources? Who is trained to do it? Ehaia for us has become a partner that has brought along what we've required, what we've needed in terms of resource materials, in terms of training those that are involved with HIV and AIDS. In terms of networking, through Ehaia we've gotten to know other organizations.
Dr. Nyokabi is in charge of St. Paul's University Institute of Lifelong Learning, Community Care and HIV/AIDS. She has been extensively involved in partnering with Ehaia to establish educational programs which address the pandemic.
I have never in my life as an academic seen anything more powerful than this. I found this program in place, but it's one program that is very, very powerful and very unique in its own way. How it works is, when we take the student from the beginning, we say that one thing, for you to do this program, you have to be willing, able, and ready to start a group. And the base means it's a group that is in your community. That's where the word base came from. So base group. So it's where you work, in the place where you are. So it should be about 20 to 25 members who you work with and meet at least once every month. So whatever you learn, whatever skills you get from the college, you go and share. Transfer those skills to those group members. The idea is that they should be people infected or affected by HIV and AIDS. And we know everyone in this continent is if not infected, they are affected.
Armed conflict in certain areas of Africa has accelerated gender-based violence, which in turn has promoted the rapid spread of HIV and AIDS. The Fellowship of Christian Councils and Churches in the Horn of Africa, FECLAHA, works in areas which have seen armed conflict. Mr. Fred Nyabera, the Executive Director of FECLAHA, explains the linkages and symbiosis between his organization and Ehaia.
We are not experts when it comes to HIV and AIDS. In the same way, Ehaia are not experts when they come to armed conflict situation. And we've seen the interlinkages between these two. And therefore, by bringing Ehaia and the expertise and bringing FECLAHA and the expertise, then we bring in some synergy that is able to add value to Ehaia's initiatives and also add value to FECLAHA's initiatives.
Ehaia has ventured into southern Sudan, running some of its programs in the region. Sudan is the largest country in Africa. Southern Sudan officially consists of 10 states, which are composed of 3 historic provinces of Bahr el Ghazal, Equatoria, and Upper Nile. This region has seen a long-drawn civil war with the mainly Arabic North. This has resulted in broken down infrastructure and gross underdevelopment of the area. The region has an estimated population of 8.6 million people as at the last census of 2008. Bishop Moses Den is one of the key contacts of Ehaia in southern Sudan. He tells us the main areas of engagement with Ehaia.
Really, we have engaged in focusing mainly on HIV and AIDS and empowerment of women. Especially when they did a workshop in Juba, the gentleman from Zimbabwe by the name Isra was very much concerned about the issues to do with women empowerment, because in this age of HIV and AIDS, it is very important that women are empowered so that they can make decisions. They are part of decision making.
Bishop Den has a number of suggestions on how Ehaia can come in to have an even better impact in the fight against HIV and AIDS.
If we could approach through media to start programs on media that will inform the community about HIV and AIDS from the Christian perspective, through the churches, because there are many people who do not have access to either radio or television. We introduce BCT where people can be tested. It will be another good thing, because in Warab state, for example, the whole state does not have even a single BTC. So when we say that HIV and AIDS rate is not high in Southern Sudan, I don't believe it, because we don't even know. How will you know if the whole state, which is actually bigger than the province in Kenya, does not have even a single BCT?
Ehaia has engaged the services of theological consultants in the Francophone and Anglophone regions. Professor Ezra Shitando is in charge of the Anglophone region.
Africa has been negatively affected by HIV and AIDS. I've written in the book, Troubled but Not Destroyed, that what Africa needs to do now is to look forward with hope and work and work and work, knowing that our salvation will come principally from what we do as Africans.
Ehaia has also partnered with the Council of Anglican Provinces of Africa, CAPA. Mr. Emmanuel Olatunji, Programs Officer of CAPA in charge of HIV and AIDS, sheds light on the symbiotic relationship CAPA has with Ehaia.
CAPA and Ehaia both seeks to address HIV and AIDS issues in Africa, and both also seeks to address it in an African context, Pan-African context. That brings the relationship, that brings the partnership and intention close. Part of the things that I have here is to just show you that this document that I show you here is one of those kind of document that CAPA and Ehaia have collaboratively developed so as to enhance HIV and AIDS coordination and capacity for CAPA, and that also translates into dioceses and provinces.
Since its inception in 2002, Ehaia has directly trained more than 20,000 church-related resource persons from all over sub-Saharan Africa, with varying degrees of success in various fields, in terms of serving those who gives them purpose for their existence, people living with HIV.
Being gentle, is that a gender or a sex issue?
Ehaia has partnered with the National AIDS Control Council of Kenya to hold training workshops and seminars on issues to do with HIV and AIDS among the clergy. In a recent workshop held in Nairobi, some of the participants had this to say.
It's good to see how people are trying to raise this topic and how to involve especially the pastors and the ministers from the churches in advocacy and in supporting the people who are affected with HIV/AIDS.
Due to the fact that HIV is somehow related to sinning, so they should read out the matter of sinning. They should just come out like other diseases. It is with us, so we have to deal with it as it is.
There needs to be awareness. I think the pulpit can be used in a very, very special way to create awareness. The pulpit can also be used to emphasize on the need for prevention, that we can actually keep well if our lifestyles are correct.
Ehaia works closely with African Network of Religious Leaders living with or personally affected by HIV and AIDS, ANERELA. It supports the Kenyan chapter of ANERELA to produce information, educational and communication (IEC) materials focusing on HIV. Jane Nganga, the national coordinator of ANERELA Kenya, singles out 2 books published with the support of Ehaia, Beyond Stigma and Pastoral Counseling.
I will talk about the booklet on pastoral counseling. It's come in handy, especially when we are helping religious leaders to develop or to come up with congregational responses. And these are usually programs for men, for women, for youth, and for children in the congregations. So this book has really helped the religious leaders to offer pastoral counseling to their members who are living with HIV.
To make HIV and AIDS education comprehensive and holistic, Ehaia has adopted the SAVE model to make this initiative more palatable. This model was developed by ANERELA. S refers to safer practices covering all the different modes of HIV transmission. For example, safe blood for blood transfusion, barrier methods for penetrative sexual intercourse, sterile needles and syringes for injection, safer methods for scarification and adoption of universal medical precautions. A refers to available medications. Antiretroviral ARV therapy is by no means the only medical intervention needed by people living with HIV. Of vital importance to every person is good nutrition and even an adequate supply of clean water, and this is doubly so for people living with HIV. V refers to voluntary counseling and testing, one intervention which may mitigate HIV-related stigma and increase the effectiveness of HIV prevention efforts. E refers to empowerment through education. It is not possible to make an informed decision without all facts. Misinformation and misaction are two of the greatest factors exacerbating HIV and AIDS-related stigma and discrimination. Education also includes information on good nutrition, stress management, and the need for physical exercise. The ABC model advocated for abstinence, being faithful, and the usage of condoms. Dr. Nyokabi compares the ABC model with the SAVE model.
The ABC was too simplistic. It just said you just follow ABC and everything will be okay, but we know even who decides on the use of a condom has a lot to do with your status, your gender, whether you need sex for a meal, or whether there are very many other factors that come into place. So that's how SAVE has come in, more than just ABC.
Voluntary testing is not only useful but very necessary in the fight against HIV and AIDS, as Edith Nkoma from Malawi explains.
I got prepared myself. I said if I'm going to be positive, I will take it positively, and then I will live positively, and I will share with people so that people should be able to know that I'm like that. And I would want to advise people to come in the open so that they can stop the spread of HIV/AIDS.
For ages, religion, hence Christianity, has been known as the bulwark of conservativeness, and it is for this reason that sensitive matters concerning sexuality, gender inequality, and other salacious topics are not always discussed openly.
If we anticipate stigma will come down by simply disseminating information, it won't. Because the realities are not finally going home. But the moment we empower the church so that it can be equipped to handle any scenario that is HIV/AIDS related, if it's nutrition, they have the capacity. If it's comprehensive care center medication, they have the capacity, then stigma will come down. Because the church will have two things. One, it has the capacity, and because it has the capacity, it will have no problem embracing.
It is for this reason that Ehaia has adopted Bible texts that are traditionally ignored or omitted as basis for regular sermons and Christian teachings. For example, in Kenya, Tangaza College, a constituent college of the Catholic University of Eastern Africa, where 25 young men training to be Catholic priests formed Tangaza Men's Initiative on Gender-Based Violence and HIV and AIDS in 2007. Mr. Chris Yaye, the coordinator, explains Ehaia's role in this initiative.
Ehaia moves into the aspect of making or creating what we call a HIV and AIDS competent churches. Tangaza was born as a theological institution. Now what Ehaia does, because of its objectives and its mission and values and the mission of Tangaza College, which now houses the Secretariat for Men's Initiative, it helps us first of all with facilities, the literature for advocacy and the training manuals that we used at the inception point. And again also some funds. Sometimes in running the Secretariat, Ehaia has always helped us with some funds for training, for facilitating the workshops and all that.
Ehaia has supported the publication of various handbooks and partnered with other like-minded organizations in its efforts at combating the HIV and AIDS pandemic. Reverend Nikta Lubale of the Organization of African Instituted Churches displays some of these resources.
We've also received support in 2008 to print 2 manuals for our work on HIV/AIDS, and that is the Pastoral Action Handbook and then the Community Action Handbook. Those have been very, very resourceful for us in working with the African independent churches, because these are materials developed by us for the churches. We had printed only 3,000 copies with the Strategies for Hope, who supported us at the beginning, but Ehaia came through and helped us to print 60,000 more copies, and that gave us the increase in number of handbooks we have, which we can share with other churches and other organizations which are involved in HIV/AIDS without any cost.
Marianne Mwangi, who lectures on HIV and AIDS Master's Program at St. Paul's University, is happy about the impact the training on HIV and AIDS has had on the students.
I would tell Ehaia to continue supporting theological institutions and universities, because these are people who have a platform to address these issues to the public. So when they continue training us, for example, we last year in December, we were called again for like a refresher course on theological consultation on HIV and AIDS. And we got to hear about the latest information on gender issues, legal issues, and the others. So they continue supporting. It's not just a one-off training and then you're left on your own. They always come back to find out, where have you reached? What challenges are you facing? How can we, as Ehaia, help you face those challenges? So I like the follow-up that they do and the long-term support.
Hulda Odhiambo, an HIV and AIDS counselor and trainer, has benefited from the St. Paul's program.
Before I came to St. Paul's, I had my visions, but they were not realized until I joined St. Paul's. It made me realize the potential within me. And as I started working with the commercial sex workers, it was with a totally different angle.
Emmanuel Rutunda, a pastor from Rwanda, believes he is equipped with the necessary skills to aid him fight HIV and AIDS back home in Rwanda.
You can see Rwanda is a country of 1,000 hills, and you can see on every hill you have a church, and if you can community to help as responsible to HIV/AIDS, I see that you can do a big job.
Venerable John Gashoki, another student at St. Paul's, believes that time has come for the clergy to accept the reality of HIV and AIDS.
I believe it should be very important for them to accept the reality that HIV and AIDS are now a reality.
Gender and sex roles in the African context and culture has contributed to the spread of HIV and AIDS. Professor Shitando elaborates.
HIV and AIDS is a gendered phenomenon and epidemic. The vulnerability of women in terms of their biology, in terms of their socialization as women, has made the lot of women very miserable in Africa. The socialization of men as human beings with unlimited sexual desire has also endangered men ourselves. And so the socialization of women as subordinate and the socialization of men as assertive has ensured that women and children and men are vulnerable to HIV. Professor Musa Duve of Botswana says something very significant about gender. She says that we know that gender is socially constructed. It therefore follows that gender can be socially deconstructed. In other words, where we have made women vulnerable, we can change the vulnerability of women. Where we have made men vulnerable by saying that men must be free to do whatever they like, we can deconstruct that role and have men act more responsibly and have women become less vulnerable.
However big the challenge of HIV and AIDS may seem, nothing is too big for the Almighty. Together we shall manage to eliminate this scourge whose impact has been felt in the entire globe.